Hello everyone, it's Dr. Fox again. Let's talk about the common iliac artery and its branches. In this video, we'll describe the pathway and bifurcation of the aorta into the common iliac artery. We'll also discuss the divisions of the internal iliac artery and the regions they serve. Finally, we'll describe the pathway, branches, and regions of the lower limb that are served by the external iliac artery. So let's begin our story in the abdominal pelvic cavity. We have the abdominal aorta, which at about the level of L4 will bifurcate into the common iliac arteries. At the pelvic brim, which is approximately there and there, we'll have the common iliac arteries bifurcate into the internal iliac arteries and the external iliac arteries. The internal iliac artery is going to serve the pelvis and viscera, as well as the perineum. The external iliac artery is going to head out into the lower limb and will serve the lower limb. One little bit of information to add here. At this bifurcation of the common iliac arteries into the internal and external iliac arteries, we can reliably find the ureters crossing from the abdomen into the pelvic cavity. Let's take a look at the internal iliac arteries. So there's the external iliac artery heading off toward the lower limb, and here is the internal iliac artery. We're looking at an illustration of a hemipelvis. So this would be a medial view of that, and we can see the urinary bladder here, we can see a uterus here, and we can see the rectum here. There's the sacrum, and there is a whole lot of vasculature to account for. Now, generally, the internal iliac artery may be divided into an anterior division and a posterior division. That anterior division, which kind of circle branches here, that anterior division comprises the lion's share of blood flow from the internal iliac artery, and it's going to serve the pelvic viscera, the perineum, and some of the gluteal muscles. The posterior division, which I can circle here, is going to serve the posterior wall of the pelvis, as well as some of the gluteal muscles. So between the two of these, basically everything within and comprising the pelvis is going to be served by this internal iliac artery. Now let's turn our attention to the external iliac artery. The external iliac artery continues on down towards the pelvis, and it will travel underneath the inguinal ligament. On the other side of the inguinal ligament, this vessel is then known as the femoral artery. The femoral artery is going to serve the anterior thigh, so the anterior compartment of the thigh. There will be a branch of the femoral, the deep femoral, that serves the posterior thigh. As it descends down through the thigh, and this is an anterior view here. Let's turn our attention to the posterior view here. As it emerges from the adductor muscles, there's a little tunnel called the adductor hiatus. So here we're looking at a posterior view of the knee. That's the popliteal fossa. The femoral artery becomes the popliteal artery. And there will be very many branches serving the knee. It's a very dynamic joint, prone to injury, so there's a lot of collateral blood flow. The popliteal artery will throw off several branches. There will be a major branch to the anterior compartment of the leg that goes down and also serves the dorsal foot. And the larger branch will be the posterior tibial artery, which we can see continuing on down here. That posterior tibial artery serves the posterior and lateral compartments of the leg. It will also throw off branches to the medial and lateral foot that have an anastomosis, so it will serve the plantar surface of the foot as well. Back to an anterior view of the femoral artery. We can see it here within the femoral triangle. So the inguinal ligament would be right about there. So that would be the transition to the femoral artery. Here is a portion of a muscle called the sartorius, which would continue on down that way towards the medial thigh. And here is another muscle called the adductor longus. And so we can then see the margins of this femoral triangle. Let's block that out again. And within that triangle, we can see the femoral vein, the femoral artery, and the femoral nerve within there. There's also some lymphatics as well. And so this femoral artery will continue down. We can see it then entering into the space of the adductor muscles, and on the posterior thigh, it will emerge as the popliteal artery. So let's test our knowledge. Which landmark indicates the transition of the external iliac artery to the femoral artery? Is it the adductor hiatus? Nope, that's the femoral to the popliteal. Is it the iliac crest? Nope. Is it the inguinal ligament? Yes. Pelvic brim? No. Popliteal fossa? No. Correct answer, C, inguinal ligament. Thank you so much for your time, and I look forward to talking to you in the next video. Take care, everyone.